I'm Val Dimmock. I'm a nurse by background, and I specialised in emergency medicine and critical care nursing. I moved into education and worked at universities for several years and gained my Masters in Education while I was doing that. And then I came back to work in the NHS to teach simulation and clinical skills at Homerton University Hospital. One of the things that you want to be as a nurse and a doctor and anyone that's looking after patients is to be competent in what you're doing. And you not only need to be competent, you also need to be confident. What we want to do is to devote more time to clinical practice, more time to learning in the ward environment and less time to classroom. So therefore we're looking at solutions that we can use to allow staff to undertake the theoretical element so we can concentrate purely on the practical element, because it's the practical element that they want to become confident in. The people are the most expensive in terms of what we're doing, and what we want is to be able to use their time much more effectively so that they can spend a lot more time with the patients. So the Elsevier Clinical Skills online learning tool was one of the solutions that we looked at to be able to develop blended learning. It gives the staff the opportunity to not only train in new skills, but it also gives them a chance to keep themselves updated. So this will reduce the time that they're away from practice. At the moment there's 150 clinical skills on there that staff can access. But having bought the product, we can now upload our own clinical skills. We can change the clinical skills that are currently on there to reflect our own trust policies. You can access it anywhere, anytime. We're working with our IT departments at the moment on linking it to electronic staff patient records so that when staff move between trusts, they can take the learning with them. The ward managers are very excited about the product, which is good because it means they can export the data, they can keep the data for their staff, and it helps us achieve good clinical governance targets because the data is readily available. And I see it as actually closing the loop, if you like, in terms of incidents happen, this is supposed to be delivered, we say we deliver it, but where's the evidence that it makes any difference? This is actually closing that loop because that evidence will be there that staff have been educated and there'll be a performance review aspect. The patients actually really like to see what you're actually doing. It makes everything transparent. It means that we're saying not everyone's an expert in everything, but what we can do is hone our skills in particular areas to ensure patients are comfortable, patients are safe, and they receive the right care.